practice, practice, practice. Practicing is key for SJT if you want to do well. Hi guys, welcome back to my channel. So today we're going to be talking all about the Dental Foundation Training Application Process, also known as DFT for short. Chances are, if you're watching this video, you're probably in your 4th year of dental school, going into final year. You've sort of heard about the DFT application process. It all just sounds a bit vague. You're not too sure about what to expect. And you just feel a bit nervous and anxious about it all. And if that is you, then you've definitely come to the right video, because I remember feeling exactly the same way last year, and I just wish that there was a video like this that just basically explained everything, which is why I put this together for you guys. So in this video, I'm going to be covering exactly what you can expect. We're going to go through some tips, we're going to go through some practice questions. I'm also going to talk about some resources that you can use, also how you can get the chance to get your hands on my notes as well. And yeah, we're going to talk about courses and also what to do if you don't actually get a place, okay? So there's lots to cover. I recommend that you sit back, grab a snack, get comfortable, grab a notepad, pen, whatever you need, and yeah, let's get straight into it. So first things first, what is Dental Foundation Training? So Dental Foundation Training is the year where you get to work in a practice as a trainee dentist. You're not alone because you have an educational supervisor who is a very experienced dentist that looks after you and helps train you along the way. Every single final year dental student, but in the UK, has to go through this application process. So you're kind of all in competition with one another, which does sound a bit scary. So after you've done your interview and your SJT, which I'll go into later, you get given a rank, okay? And this rank, depending on how well you do, determines what scheme you get. And from that scheme, you get to pick what practice you want to go to. The reason why we have this application process is because back in the day, they didn't actually used to have sort of a national recruitment process. You just get to pick what practice you want and you go there. But this could be very biased, because if somebody had, let's say, a dentist in their family or their mum was a dentist, they could easily just go work in their mum's practice, and say someone else didn't know any dentist, they would find it really hard to get a place. So that's why they've put this whole process into place, to make it fair and equal for everyone. In 2019 to 2020, which was the year I applied, there were 1,110 applicants and only 883 offers were made, okay? So that means that some people were actually left without a place. Don't worry, in the end of this video, I will cover what you can do if you find yourself in this position. So the ranking that you get is made up of 2 parts. You have your Situational Judgement Test, so your SJT, which gives you 50% of your score, and then you have your interview, which gives you the other 50%. So first and foremost, we'll focus on the SJT. Before you can sit your SJT, you have to sign up and make an account through Oriel, and this opens around mid-August. So I'd really recommend that you do this as soon as possible, really, and don't leave it until late, because basically if you don't have an Oriel account, you can't do your SJT, or you can't even do your interview. So get your Oriel account made as soon as possible. I found making an account on Oriel, it was a bit confusing in some parts, so I'll save you guys the trouble and talk you through it. So once you've made your account and filled out all the relevant sections, it should come up with 100% in each section. Once that's done, you can submit your application and send it off. After that's all done, you're going to receive an email to tell you that your registration has been successful. Happy days, we're getting somewhere. So once that's all done, that's the first of many emails you're going to get, by the way. It becomes like UCAS all over again. Oriel does send you a lot of emails. So make sure, top tip, make sure that when you register, you don't use your university email address. Use your personal email address, because you check your personal email address a lot more regularly. You don't want it to end up in your spam or junk mail or anything like that. Another thing to consider is that if you register with your university email address, that might actually expire before your DFT start date. So you want to make sure that you use an email address that you're going to have for a long time and that you check regularly. So on the 1st of October, around this date, you're going to receive another email which tells you about details on how to book your SJT. I remember when we got this email, everyone was literally freaking out because everyone wanted to get a good time slot, because to book your SJT, it's literally first come, first serve, okay? So you got to be quick. There are 180 test centres around the UK, so there's a variety, but the likelihood is that everyone in your uni is going to want to go to a test centre near your uni. So you have to quickly log on and get a good time slot. If you don't get a time slot in your uni area, then that means you might have to travel somewhere else to do it. So you could go back home to do it, or you could just go to a nearby city. So I went to Plymouth. So if I didn't get a time slot, I'd probably have to go to like Exeter to do it or something. So once you get that email, log in as quickly as possible and try and get a time slot. Things to consider about the time slot is what time of day you want to do it. So if you're a morning person and you know that your brain works better in the morning, then book an early slot. Whereas if you like a bit more of a lie-in, then book an afternoon slot. Also, it's important to consider your patience. Obviously, you're in final year, you probably have targets to meet and you have your final case presentations going on. So if you've got a really important patient booked in on one of those days, you might want to do it on another day, because they give you like a whole week where you can pick what day you want. So make sure that you consider that as well. In order for you to book your slot, you have to go through the Pearson VUE website. You've probably all heard of Pearson VUE before. It's where you've done your UK CAT, if you remember that, fun times, or when you've done your theory test. So that's the same place where you'll be doing your SJT. So what happens is that you log onto their website, and I'll just give you a quick disclaimer that there is quite a lot of things to fill out before you get to the time slots. So be wary of that, because I remember we were all trying to be quick, but we didn't know that we're going to have to fill out so many things. So be prepared for that. Once you've done all of that, you'll get to a page where you have all the time slots ready for you to pick one, and then just pick a time slot. It doesn't matter if it's a weekday, obviously, because your university they'll give you authorised absence for your SJT. So just pick a slot, and if you do end up picking a slot and then you think like a couple of days later, oh man, like why did I pick that slot? I want a different time. Don't worry, you got up to 48 hours from when your SJT is due to start to change the time, okay? So you can still change it, so don't stress. I remember I picked a time that was like 2 PM, and then I realised that, oh, nah, I want to get over and done with earlier, and all my friends had the 8 AM time slot on Saturday, so I decided to, I checked the website every day and I saw that slot opened up, so I quickly booked that one in. So don't stress, you can still change the time, the date, and even the location if you wanted to. So once that's all done, you are now ready to take the SJT. So what happens on the day of the exam? Obviously, you need to make sure that you've had a good night's sleep beforehand. It's really important that you're well rested. Obviously, you're going to be nervous, but don't compromise your sleep, okay? You need your brain to be functioning at maximum capacity for your SJT. Then start to make your way to the test centre. It's really, really important to not forget your ID, because if you forget your ID, you will not be allowed to take the assessment. I repeat, you will not be allowed to take the assessment, okay? So don't forget your ID, people. Also make sure that you leave early, you have enough time to get there. I'd recommend that you even practice going there like the week before, just so you know exactly what way you're gonna go. You don't want to get lost or anything like that, because if you turn up late, you will not be allowed to take the assessment, okay? So make sure that you are on time and you remember your ID. One thing that they don't tell you is that if you get there a bit earlier than your time slot, you can actually sit the test earlier. So don't forget that people there are doing their theory tests and UK CAT. I doubt people will be there doing their UK CAT at the time that you're going to be doing your SJT, but yeah, it might be a possibility. So if there is a free computer slot earlier than your time, they actually let you go in earlier. You have to hand in all your belongings, so your bag, your water, you're not allowed to take any food in there. So make sure that you've had a good breakfast and you're well hydrated. Don't overdo it on the hydration part, because you don't want to be going to the toilet every 2 seconds, you know. You don't have a lot of time in the SJT. So just make sure that you are comfortable, you've had a good breakfast and you're well hydrated. And then, yeah, once that's done, you head into the room. You're in like a small, like a little cubicle where it's just you. You have people like next door to you, but there's like little cubicles, so you don't get distracted by them. They'll give you earplugs, and they'll also give you a pen and a paper to scribble on. If you run out of paper, you can always request for more, so don't worry about that. So once that's all done, you are ready to take the test. So now onto the juicy part. What are they going to ask you in the SJT exam? Okay, so the aim of the SJT exam is to assess how you will respond in work relevant situations. Okay, they're not looking at your dental knowledge. They don't want to know whether you know all the branches of the mandibular nerve, if you can define a class 2 DIV2. No one's going to ask you about that. It's purely to assess your judgment in situations, which is why it's called situational judgment. So they want to see your ability to make decisions under pressure, to see whether you can work in a team, to see if you're empathetic, to see if you're resilient. They just basically they create different scenarios to try and assess these key qualities. Okay, so that's the whole reason why they have it in the first place. So the SJT is actually split up into two parts. You have ranking based questions, and then you have best of 3 type questions. Okay, so I'm going to give you examples of both so you know what to expect. First, we'll try and do a ranking based question. I'm going to put it up on screen, and I advise that you give yourself 2 minutes to try and answer this. If you need to get your phone out to time it, feel free to do that as well. So I'll pop the question up on screen, and feel free to pause the video. If you do need to take longer, that's fine as well. The more you practice, the faster you will get, okay? So pause the video now, and then after I will discuss the answers. So the correct answer was B, C, D, A, and E. So if you got them all right, congratulations, give yourself a pat on the back. That means you get 20 marks altogether. So that's the total amount of marks you can get for each right answer. Each correct answer is worth 4 marks, okay? So for example, say you put C before B, then you'd only get 3 marks for that one, okay? And so on and so forth. I'll put an example of the mark scheme on screen so you can tally up the score you got, okay? And then you can see what to improve on. Okay, so now we're going to discuss why these were the answers for those who might have got it a bit muddled or mixed up, okay? So the reason why B was first is because you are going to your educational supervisor for support. This is a scenario where you're constantly running behind schedule, and your educational supervisor, at the end of the day, they are there to support and help you, especially in a scenario like this. Okay, so you don't want to hide it from them, so let them know so they can help and support you. Top tip, if you do have a question like this and educational supervisor is part of the answers, that's probably going to be one of the higher scoring ones, because it's always good to get your educational supervisor in to support you. C is second, because even though it does resolve the problem, getting your educational supervisor is better in this case, because they are able to give you that support and they can give you tips for what you can do to improve. And then you have D, which is essentially telling the practice manager, and that's kind of like you shifting the responsibility, and you're kind of complaining about the nurse when she hasn't done anything wrong. She's just telling you that, hey, look, you're kind of running late all the time, and she's just being honest and truthful. So for you to go and tell the practice manager just is it's not the best option in this case. And then you have A and E, which are obviously the bottom answers. I hope none of you guys put those first, because if you did, I'd be worried. Yeah, A is just telling her that she's not a team player, and saying stuff like that will just make the situation worse. So that's why that's there. And E is right at the bottom, because if you carry on with the treatment without a nurse, you are putting the patient at risk, and we're not allowed to practice without nurses. So anything that puts the patient at risk or jeopardizes their safety, and that's not in their interest, then that goes automatically straight to the bottom, okay? So that's why E was at the bottom. So I hope that makes sense. I hope you guys done well on that one. If you got a couple mixed up or muddled, don't stress too much about it. This is what it's all about, you know, practicing, and at least you know why you got it wrong, okay? So yeah, let me know how you guys got on actually in the comments below. I'd like to see how you guys got on, and if you are enjoying this video so far, please do give me a thumbs up and subscribe to my channel down below. That would really help me on my channel. Okay, so let's go into the next type of question that you could get, which is the best of 3 scenario, okay? So this is different from the ranking. So once you finish doing the ranking, you have to sort of have like a mind shift and go into the best of 3, because when you rank, these answers are all individual from one another, but when you go to the best of 3, you have to think what 3 will work well together, okay? I'm gonna put up an example, and I'll give you 2 minutes to read through it. But with this one, try and think which 3 will work well together in this scenario, okay? It will all make sense after, okay? So I'm gonna put it on screen, and yeah, give it a go, and we'll discuss after. So the correct answers were, drum roll, A, C, and H. Okay, so if you got those all right, well done, give yourself a pat on the back. You get 4 marks per every right answer, so you get a total of 12 marks. With the best of 3, the problem with this one, you can actually end up scoring 0. So I'd really advise that you try your best to at least get 4 marks, because you want to try and get as many marks as possible. I'll quickly run through why this was the right answer. So obviously A, you want to acknowledge the patient's inconvenience and just let them know that it's practice policy. Obviously cold sores are very contagious. It's herpes simplex, so you don't want to be treating that patient with cold sores because you might catch it yourself. And then just recommend them with some over-the-counter antivirals like acyclovir, and yeah, and then just book them in for next week, which was the right sort of combination there. So the other answers that you might have picked B, which is asking the educational supervisor to have a look. But in this case, you won't really do that. It's different to the first one because you know already that it's practice policy not to treat patients with cold sores. So by getting your educational supervisor involved, you're actually putting them at risk of catching it. So yeah, you wouldn't do that. And D, so D was bringing it up at a practice meeting, which is, some of you might have put that, but there's actually no point bringing it up at a practice meeting if it's already practice policy. So yeah, that wouldn't be correct. And the rest of the answers, I'm not going to go through them because you should know that they were unreasonable, and I hope no one picked those. Yeah, so we will move on. Okay, so now you guys know what to expect from the questions from SJT. I hope you guys found that useful. So now I'm going to go into some of my top tips of how to do well in the SJT. So what I'd say is always rank the top and bottom ones first, because straight away you're going to have a feeling of which one is the most right and which one is just no. So for the ranking ones, do the first and the last one first, so at least then you have 2 correct answers, and then just sort the other middle ones out after. Remember that if you ever need to escalate a situation or you need help, go to your educational supervisor. They are there to help you. If the scenario involves your educational supervisor and you need to speak to someone higher than them, then you report to the TPD, which stands for the Training Program Director, okay? So remember that there's a hierarchy, and just don't take on too much yourself. Also remember to think like a foundation dentist. You're not a student, you're a foundation dentist. When you answer these questions, put your dentist cap on and think like a dentist, because that's what you're going to be soon. Also, use this book. I highly recommend it. It's the Dental Foundation Interview Guide by Zahid, Shavana and Helena. You can order this online. It's quite an old book, but it's still really useful. So what I've done, you can see here, I've got loads of sticky notes in here. So the reason why I like to use sticky notes, so you can see, I just jot down my answers and then I could easily mark it on the go and just keep it on that page. So if I wanted to refer back to it, I could. I did look a bit crazy sometimes. I'll be on the bus with just like my sticky notes and doing my SJT questions, but I found that really useful rather than just carrying a big notepad around with you. So yeah, practice, practice, practice. Practicing is key for SJT if you want to do well. Once you've gone through all the questions in the book, then I recommend you start doing some questions online or find some more resources. I'll leave some links to some resources in the description box below that you can practice on. So lastly, one other useful platform for practicing the SJT is run by Dental Protection. They have an online learning space called Prism, and that's really useful for practicing SJT questions. You're probably already a Dental Protection member, but if you're not, then yeah, I'd recommend it because you can have more practice. But yeah, so that's it for SJT. We will now move on to the next section, which is the interview. I know we've been going on for a while now. If you want to pause the video and have a quick break and come back for the interview section, that's fine. If not, just carry on and we will go straight into it now.